And as I was introduced, I studied at Phoenix Institute of Herbal Medicine and Acupuncture. These are my other degrees. Today I'll be talking to you about acupuncture for GI disorders. Okay, here are some of my other publications. The objectives here are going to do a quick overview of acupuncture, which many of you already know. We'll operationally define acupuncture. We'll provide an overview of GI disorders. We'll operationally define GI disorders, and then we'll discuss benefits and protocols for GI disorders, all referenced and researched. Okay, so acupuncture, here's a quick overview. It has a history spanning over 2,500 years. In the Huang de Nijing, a Chinese medical text compiled back from 800 to 300 BC, methods and clinical uses of acupuncture were thoroughly documented. In modern development, Western interest in acupuncture emerged after President Richard Nixon's visit to the People's Republic of China in 1972. During this visit, a journalist from the New York Times underwent emergency appendectomy. He developed a post-surgical paralytic ileus, and that was reportedly alleviated by Chinese acupuncturists. So, hence and subsequently, acupuncture's application in anesthesia has been reported in Western literature. And over the past 3 decades, the use of alternative medical therapies, including acupuncture, has expanded and continues to expand significantly. All right, operational definition of acupuncture. It's part of a larger practice, traditional Chinese medicine or TCM. The use of very thin needles are inserted at specific points on the body, and it helps to relieve pain and treats a wide range of conditions. It supports balance and flow of the body's energy, also known as qi, stimulating nerves and muscles. It encourages the body's natural healing processes and promotes release of natural pain-relieving chemicals, commonly used for headaches, back pain, nausea, stress, fertility support. All right, what are GI disorders? They encompass conditions affecting the digestive tract all the way from the mouth and esophagus to the stomach, intestines, liver, pancreas, and gallbladder that disrupt digestion, nutrient absorption, or waste elimination. Symptoms can include and are not limited to pain, bloating, gas, heartburn, diarrhea, or constipation. Severity ranges from mild, such as indigestion, to severe, which is Crohn's disease and digestive cancers. GI issues can be acute, like food intolerances, or chronic, such as IBS or GERD, and can impact energy, growth, and tissue repair. So here's a little bit about prevalence. It imposes substantial societal and economic burden. An estimated 60 to 70 million people in the US were affected in 2004, and they are accounted for approximately $142 billion in direct and indirect costs. And so there's need for cost-effective treatment strategies. So increased attention has focused on acupuncture as a potential therapy for GI diseases. Ongoing research examines the efficacy and underlying mechanisms of acupuncture in GI treatment. All right, what causes GI disorders? We have gut inflammation, poor diet and nutrition, food intolerances and sensitivities, stress and anxiety, irregular sleep patterns, glandular and organ malfunction. Additionally, it could also be parasites, bacterial overgrowth, things like candida and so forth. All right, benefits. It can of acupuncture for GI disorders. We can reduce inflammation, regulate gut motility, and ease pain and discomfort. If I will offer these slides to anyone interested, I'm not going to read all of the details under the benefits because I do want to get to some of the protocols. More benefits of acupuncture for GI disorders is it manages nausea and vomiting, balances stomach acid, and improves blood flow. It also alleviates stress and anxiety and supports the gut microbiome balance. And it can provide significant relief from acid reflux and GERD, constipation and diarrhea, IBS symptoms, bloating and stomach cramps, and symptoms of IBD. Now, how does acupuncture work for the digestive system? It addresses root causes of digestive issues, like bringing lasting relief by helping the body to reset and rebalance. Again, it uses fine needles to stimulate points that improve circulation, reduce inflammation, and thereby regulating digestion. It offers a low-risk, drug-free, and holistic approach to managing digestive health, often used in conjunction with conventional treatments and dietary changes for long-term wellness. Here's some research. Acupuncture shows dual regulatory effects on gastric motility. So essentially, it enhances gastric peristalsis in subjects with low baseline motility. It suppresses gastric peristalsis in subjects with high baseline motility. Regulatory effects on gastric motility may be dependent on stimulation intensity, meaning stimulation of the acupuncture needles. Acupuncture is an effective adjunct or alternative therapy for various GI-related conditions, and it's shown demonstrated benefits in chemotherapy-induced nausea, post-operative nausea and vomiting, peptic ulcer disease, and post-operative ileus. So I've used it on patients who are having chemotherapy-induced nausea to help them manage those effects. The citation is below. I have more research in the ending of my slides and a list of references. And so TCM acupuncture is characterized by what's called bidirectional or opposing regulatory effects. The effects of acupuncture vary according to the physiological state of the individual. So acupuncture can either enhance gastric peristalsis, and that would be when gastric motility is low in the patient, and acupuncture can suppress gastric peristalsis where baseline gastric motility is too high. So it can serve a nice regulatory effect there. Here's a chart of some points and its effects. I'll go into some of these in details. And again, I will offer these slides for anyone who's interested. And this comes from Lee et al. 2015. Okay. It's effective for functional GI disorders such as IBS, constipation, diarrhea. And again, we're going to regulate GI motility. We're also going to protect gastric mucosa through acupuncture and a reduction of visceral hypersensitivity. Treatment points and meridians is acupuncture at Zusan Li or stomach 36. And that improves upper and lower abdominal symptoms. It restores impaired gastric slow waves, and it acts the vagal pathway. Electric acupuncture at foot yang ming or the stomach meridian enhances gastric motility. It also improves gastric mucosal blood flow and regulates motilin and somatostatin levels in central and peripheral regions. Now, acupuncture applied at PC6 or stomach 36 in rats significantly enhanced gastric motility. Stimulation at CV12 or REN12 significantly suppressed gastric motility. And here's your visual. I know many of us here studied acupuncture, do acupuncture, no acupuncturist, but it's just a really good visual where you have the nipple line and foresoon to REN, and then foresoon to the other nipple line. So you can see CV12 roughly in the middle of the abdomen. Stomach 25 is at the level of the umbilicus. Some in the region here. PC6 is at the wrist. Then you have stomach 36, which is more at the knee, and so on. So just a visual of where some of these acupuncture points are located. Okay. Acupuncture and the regulation of visceral sensitivity. So IBS is a chronic functional GI disorder. It's characterized by recurrent or persistent abdominal pain and discomfort and altered bowel habits, so diarrhea, constipation, and other alternating discomfort patterns. Symptoms often interfere with daily activities and quality of life. So clinically, acupuncture is recognized as an effective therapy for managing abdominal pain in IBS patients. Electric acupuncture reduces chronic visceral hypersensitivity in IBS models. So chronic visceral hypersensitivity is a key pathological feature of IBS, and research has shown in animal models EA at bilateral stomach 36 and stomach 37 was effective. Significantly reduced CVH induced by neonatal colonic irritation.
So I'm setting everything up for Patrick in this room.
Okay,
I'm gonna run over and get a juice
can we
and
mute that,
granola
whoever
bar.
that is,
Do you need
please?
anything else?
Sir,
Like kombucha?
can we mute? Thank you so much. Alrighty. Okay, and essentially, in that research, they also used a sham for EA at stomach 36 and 37, and no reduction in CVH was observed. Right. EA at non-acupuncture points, such as bladder 62 or tail. So just to reword that, essentially what research showed is in animal models, EA at bilateral 30, stomach 36 and stomach 37 did reduce CVH induced by neonatal colonic irritation, whereas the sham EA did not show that in the research. So the findings support that acupoint specificity of EA, so that's stomach 36, stomach 37, bilateral, and exclusion of placebo effects in EA treatment. I know a lot of times people think, oh, acupuncture and holistics, well, there is the placebo effect, but we do have research to support the efficacy of the actual acupuncture itself. So EA at stomach 36 and 37 reduces visceral hypersensitivity in rodents, IBS and CVH models, which we just covered in the last slide. A little bit about the opiate pathway. EA analgesia is blocked by naloxone, indicating opiate involvement. And then we have the serotonin. Sorry, it's really early in the morning here due to time zone differences. Serotonergic pathway. EA reduces sensitivity via 5-HT3 and or 5-HT4 receptors. And then conflicting results may reflect different acupoints used. Peripheral evidence, EA decreases hypersensitive responses to colorectal distension as well. And abdominal EMG and AWR show reduced visceral pain. CNS system modulation is key in EA's effects. And so there's some spinal cord regulation. So electric acupuncture reduces PNR1, which is phosphorylated NMDA receptor in L4, L5 segments. So sort of lower back pain, but we're specifically talking about GI disorders here. And so it's basically essentially saying that due to central nervous system modulation and putting the gut system into parasympathetic, and that's how it impacts visceral hypersensitivity. As for the hypothalamic CRH regulation, CRH increases rectal sensitivity and antagonists reduce it. EA at stomach 37 lowers hypothalamic CRH, decreasing visceral sensitivity. I found that interesting. All right, now we have the brain-gut axis. We talk about when you try to digest something when you're in a sympathetic fight or flight versus when you try to digest something when you're in parasympathetic, right? But we're not just talking about, okay, I went running and now I'm trying to eat. We're also talking about like a person's constitution. Like if a person is under chronic stress or has chronic deficiencies or chronic brain-gut axis situation, acupuncture has been shown to start to regulate that BGA. And that's really exciting. So BGA connects the CNS and the GI tract. The brain signals regulate gut sensation, movement, and secretion. Gut microbiota can influence brain function. For example, if we have gut microbiota and we're not digesting right, then all the nutrients from the food aren't going to our various parts of our body and the brain, creating brain fog, difficulty concentrating, and so forth. So microbiota-derived signals affect mood and behavior. The BGA includes CNS, ANS, the HPA axis, and brain-gut peptides. So the autonomic nervous system, the hypothalamic pituitary adrenal axis, and brain-gut peptides. So an fMRI study shows that, once again, stomach 36 acupuncture modulates neural activity. It affects cerebellar, and limbic regions. Key brain areas in functional dyspepsia, or FD, are the anterior cingulate cortex, the prefrontal cortex, and caudate tail, all involved in gastric perception. Acupuncture effects on brain activity. It deactivates primary somatosensory cortex and cerebellum, and it activates visual-related cortex. More about the BGA. Brain-gut peptides are found throughout the GI tract and CNS. They help regulate GI functions and signaling. So we have substance P and SP, so tachykinins. They're involved in smooth muscle contraction, secretion, and tissue growth. So electric acupuncture effects on SP and VIP in IBS models is that EA reduces SP and VIP vasoactive intestinal peptide secretion. And this may underlie its therapeutic effect in IBS rats. Then you have motilin and cholecystokinin, CCK. These are key regulators of GI motility. And again, EA at stomach 36 increases motilin and CCK, which thereby improves GI myoelectrical activity in rabbits. We have ghrelin and NPY, orexigenic peptides. EA may downregulate these peptides, which leads to reduced food intake in rats. Again, here is a chart indicating these results. Some key points that were utilized are your LI4, Hegu, PC6, Negwan, and stomach 36, Susan Lee. And at the risk of sounding redundant, I'm happy to share these slides, and the referenced study is in there too if you would like to follow up and read the study and have access to the study. Acupuncture targets the gut-brain connection. Stress plays a major role in digestive health. Balancing stress through acupuncture helps calm stomach spasms, decrease inflammation, and restore regular bowel movements. And finally, to summarize, acupuncture restores gut-brain communication, reduces inflammation and stress responses, modulates the brain-gut axis, improves coordination between the central nervous system and the GI tract. It reduces visceral hypersensitivity. It activates opioid serotonergic and adrenergic pathways, decreasing pain and discomfort. Improves GI motility and secretion. Regulates key gut hormones and peptides such as motilin, CCK, SP, VIP, and ghrelin. Normalizes gut microbiota function and influences microbial balance and gut immune responses through neural and hormonal pathways. A little bit in layman's terms, why I like acupuncture for GI disorders is because many times when I see people with GI disorders, they're being prescribed medication. And medication and pharmaceuticals has its place, okay? But imagine a person's having GI conditions and now we're putting synthetics and pharmaceuticals in that system, and that system's already compromised, and we're expecting a compromised GI system to digest synthetics. So if a person is on synthetics and is having some side effects from those synthetics, we can use acupuncture for all of these reasons to support it. Maybe in a future talk, I'll talk about the GLPs that are happening. So I do have people who are on GLPs who are using them for weight loss, and they're having side effects, but they really want to stay on those medications for weight loss. So we use acupuncture to support the side effects. So I really think acupuncture is a wonderful modality for all things GI, and the research supports specifically for GI disorders. And here are the references as promised. Here's a little bit about me. I'm adjunct faculty at Pima, Southern New Hampshire University. University of Arizona Global Campus, and Laramie County Community College. And here's a little bit of pictures. I want to thank you very much. I'm always looking for opportunities to teach. And so please reach out. I'll leave my information in the chat. My practice is Shay the Coach Acupuncture in Mesa, Arizona, and that was acupuncture for GI disorders.